I'm Dr. Bill Sopchak from the Sopchak Natural Health and Wellness Center, and today we're going to be talking about the nasal release technique. As we go through this technique, I'm going to give you, I'm going to give you a lot of information. We're going to talk about, what is this? What kind of technique is it? How does it work? Is it new? Is it something that's been around? Is this something that just, happened? What kind of conditions have been shown to be helped with the nasal release technique? Are there any contraindications, side effects? And when are we actually going to bring this into the office and get started on it? So I put on here, I never heard of this before, because a lot of people may not have heard of nasal release technique. There's a whole bunch of different names that it comes by. There's nasal specific technique, functional cranial release, neurocranial restructuring, cranial facial release, nasal cranial release, endocranial adjusting, and bilateral nasal specific adjustment. And there's probably more. Those are the only ones that I could find, but that's a lot of them. And they basically all do the same thing. There are some little nuances in some of the techniques that are a little bit different than others. One of the things that this technique, specifically nasal release technique, does is it utilizes eye movements, which we'll get into a little bit here shortly. What is nasal release technique? Nasal release technique is a structural technique, and it's used to adjust the bones of the skull. Now, what we do is we use this small finger cot, which looks kind of like this. It's like it goes over a finger, and we put it over a bulb, which looks like this, and we attach it to that, and then you pump it up. And the goal is to use the balloon to separate the tissues to enhance function of the nasal passages. Basically, when the balloon presses outward against the bones, these are the bones, of course, that line the breathing passages. It helps to adjust the sutures of the skull, particularly the sphenoid bone, which we're going to talk about here in a minute or so. But ultimately, this ends up relieving the forces that have gone through the skull by releasing any impactions in the cranial sutures. Now, a lot of people don't realize that the skull moves. We're going to talk about that in a second too. Now, there's three different sections that's in the nasopharynx. And the nasopharynx, when you go into the nose, there's basically three different parts that go to the nasopharynx. There's a lower, an upper, and a middle. And then, so there's three on each side, and these are called the turbinates. And so when we insert the balloon in there, we're putting it back into the turbinate as far as we can. And when we pump it up, it eventually will go back into the nasopharynx, which is essentially the back of your throat. It helps the breathing passages. It helps mobilize the bones of the face and the cranium. I've been doing it on myself now for about a week, as well as my family members. And, we'll get into it more. But by restoring the normal cranial motion, taking the torque off the dura is the tissue that surrounds the spinal cord. And that allows for better movement of the CSF, which is your cerebral spinal fluid. But this increases the oxygen carrying capacity of the brain. It increases vascular flow to the brain. It increases the venous and lymphatic drainage. That means the garbage that is up in there that needs to be removed. It relieves tension off the anterior attachment of the dura to the front part of the skull, it's part of the skull or the cranium. And it optimizes the function of two primary control centers of the body, namely the brain and the pituitary gland. So, how does all this work? Well, first of all, you have to realize that the skull is not one bone. It's made up of 22 different bones that actually move. So every time you take in a breath or you breathe in, it causes your cranium to expand a little bit, your skull to expand a little bit. And when you let your breath out or you exhale, it allows it to relax and compact. Now, the purpose of this is to pump that cerebral spinal fluid down the spinal cord and down that spinal canal and bathe the entire central nervous system. Each one of the cranial bones has its own direction. So remember, there's 22 bones, and they all kind of move differently when you're breathing. So any restriction to that motion will be a problem, because that's going to change the ability of the body to allow this cerebral spinal fluid to flow properly. That becomes a problem because you end up with a lot of different issues, whether they're symptoms or they're neurologic issues, chronic things that happen or occur. And sometimes, you don't even know an issue until it's been there for a long time. But regardless of common opinion, the cranial bones do move. And there's a lot of people that think, oh, well, your head is a skull, it doesn't move. There's these little sutures in between all the bones that are like this, and when you breathe, they will move in and out, okay? It's not a huge movement, but it's just a little bit of an ability to expand and move. And when that can't happen, again, then we have problems moving that cerebral spinal fluid through our body. Now, the way this works is, as I said, we take this device, we put this balloon on it, and when we pump it up, it causes the balloon to inflate, okay? That goes in the nasal cavity and it expands. It doesn't like blow things out because it can go back, so it relieves the pressure that way. And again, we're not going into your actual sinuses. We're not even touching the sinuses. What we're doing is we're going through the nasal canals, okay? And I told you that helps movement. So I'm going to get a little bit, I'm just going to explain things a little bit more in detail here now. The first one that when we put put the balloon in the nose the first time, we have to get it in there. And we actually use a small, it's actually like a toothpick, not a hard one, but I mean, not a pointy one, but it's kind of flat. And we run it right along that lower sinus, okay? And that's the first insertion. That's going, remember I told you there's 3 on each side. That's going to affect 2 major bones, and that's going to be your maxilla and your palatine bone. Now, the palatine bone is 2 small little bones. They're L-shaped and they're in the back of the hard palate. I'll show you another picture here in a second. But realize that these form the roof of the mouth. They form the lateral wall of the nasal cavity, the floor of the eye socket, and they can get jammed at birth, especially if somebody has been sucked out or, when they use those forceps to pull a child out. Also realize, remember that canal is very small. When the head goes through, the skull plates move. And when they move, if they don't always get back into the same place. I know I had to do a lot of work on my first son, Adam, because his head was completely misshaped because he was took 2 hours to get out of the birth canal. And so we had to do a lot of work on his head to get his head to, to look normal again. His cheeks were all messed up. These bones also articulate with or communicate or touch 6 other bones. So when you move the palatine bones, it's going to have an effect on 6 other bones in the cranium of those 22 bones. Now, the maxillary part of this, if you can see on here, the maxilla is this front part. I hope you can see my cursor on here. It's this front part of the face. It's just right here, this whole area right here. It forms the upper jaw, the palate of the mouth. So the palate is this part right here. And if you can see this part right down here where I'm running my cursor, that's the palatine bone right there. That's the bottom part of it. But there's also sinuses in the maxilla. It forms the roof of the mouth. It's the floor and the lateral wall of the nasal cavity, which is all through right in this area here. And it forms the inner wall of the orbit. So it's also part of the eye orbit. That bone, the maxillary bone, communicates with 10 different bones of the cranium. And then the next part, it would be when we go through not the bottom part, but the middle part going through the turbinates between those turbinates there. Now we're going to be working on the zygomatic bone. This is the zygomatic bone right here, and you can see it's in blue right here, and it's in blue right here on the bottom picture to the right. So you can see that it forms the prominence of the cheekbones. It forms the lateral wall and the floor of the eye, the eye socket or the orbit, and it forms a part of the temporal bone. It communicates there, and it articulates with 4 different bones: the frontal, the sphenoid, the temporal, and the mandibular, and the maxillary bones. The last insertion is the top insertion. Okay, the top insertion is the one that goes and affects the sphenoid bone. The sphenoid bone is the most important bone of all of these, but not the only one, because remember I told you those palatine bones are really important to get moving as well. When we look at the sphenoid bone, the sphenoid bone looks like a butterfly here. You also can see it down here on the lower picture. It's the yellow part right here that I'm circling. It's right on the side here, and it's when you look at with the head essentially lopped off, the top part of it, looking down into the skull, it would be this yellow part right here. The pituitary sits on it, which is really important. It forms the base of the cranium, which we just talked about, and the sides of this part of the sides of the skull, and it forms the floor and the sides of the eye socket. It also contains 2 sinuses, and it articulates with 9 different bones. So again, you can see how when we start moving a couple of these bones, we're working with a whole bunch of ability to communicate with the entire cranium. The primary bone, as I told you, is this sphenoid bone. This is the eye socket over here, and the figure to the farthest to the right. The sphenoid bone is this purple area right here, and it also right on the side here. This was the zygoma bone, the zygomatic arch, this blue one, but this is the sphenoid. You can see how it's right in the back of the eye socket. It houses, as I said, the pituitary gland, and remember, the pituitary gland controls your thyroid. So when you have thyroid stimulating hormone is released from your pituitary. So when the bones of your skull are not moving properly, it's going to actually affect your thyroid as well, and all of your hormones, therefore, and your energy, and a whole bunch of different things that we'll talk about. So the biggest part of this, though, is where the sphenoid articulates with, and you can see this is the back of the skull, where that big hole is. That's called the foramen magnum. And that hole is where your spinal cord goes down from your brain. Your spinal cord goes down through your spine. Right at this area right here, this junction, this is called the spinobasilar junction. And that area has like a disc, kind of like your pubic symphysis, the pubic bone in the front. It has a disc that allows it to shift and to move. And it allows for flexion and relaxation of the cranial system, again, when you're breathing and when it's moving. And all cranial motion revolves around this specialized joint. And it's the primary joint we're targeting here with the nasal release technique. Now, if you look in the eye socket, okay, this is what we see. We see a whole bunch of bones here. We see the lacrimal bones, we see the sphenoid bones, we see the ethmoid bone over here, we see the zygoma bone, we see the palatine bone, which is right here, and what else did I miss? The frontal bone, which is up here. So these are all the bones in the eye socket. Now, why do we care about articulations? Well, here's the thing. The reason I just showed you the picture of the eye socket, which you can look down here, the main thing here is that this is an eye, and you can see that there's 6 muscles that are attached to this eye, okay? 5 of those 6 muscles attached to the sphenoid bone. And so one of the things that we know is that we evaluate people, we will be evaluating people for all movements of your eyes. And the reason is because when you find a restriction, whether you're looking up or down, and you can try this right now, look straight up and then look straight down. See if you feel a difference there. You can look all the way to the left and all the way to the right and see if you feel a restriction. If you feel a restriction in any of those movements, that tells you that there's a problem there. I was restricted moving to the left, but I have no problem at all anymore. So an issue with eye movement likely means we're going to have an issue with cranial bone movement. And so this kind of thing can happen with traumas, all kinds of different traumas, like whiplash, like concussions, like childbirth, which we talked about, increased intracranial pressure. There's a whole bunch of different things. I just named a few, so we were not here all day, but there's a whole bunch of different things that can change how the bones of the skull move. And we can use the eyes when we start adjusting and moving the cranial bones. We can also use the eyes to help facilitate movement when I'm not doing it. Okay, so this is something that you would do at home in order to continue to facilitate the treatment parameters. This is just two different pictures of that sphenoid bone that I told you was sitting there. You can see the one on the left is kind of twisted and tilted. The one on the right, actually, it says lateral strain. It was moved over, but it changed in this one. But that's when the bone, when one's sitting on top and it shifts one way or another. But when they shift, remember, it's going to affect everything. It's going to change your face from one side to the other. It's going to change all the bones. It's going to change the ability to breathe. There's a whole bunch of different things that it affects. So when we get going through this, these are the types of eye exercises that we send you home with. Now, is this a new technique? That's what everybody wants to know. Did you just learn that? I've known about this technique for a long time. I just never took the time to go to the seminars and learn how to do it. But there's a lot of reasons that I decided that I wanted to try to learn this technique. And one of them is because we were in a car accident. My wife and I were in a car accident back in 1992, January of 92, and she had a skull fracture. And ever since then, with different types of weather changes, she gets headaches. She's been getting ringing in her ears. And I wanted to be able to find a technique because nothing that I have done has been able to change those barometric pressure changes. And so there's nothing that I've been able to find that I could do, whether it be chiropractic adjustments, whether it be using percussion to try to change the sutures in her skull the best I knew how at the time, whether it be using nutrition or emotional work or anything else. There was nothing that I could find that takes those headaches away. So that's why I wanted to learn this technique, really to help my wife more than anything else, but also because it's such a huge technique. I mean, think about kids who are getting concussions. Think about veterans who have had concussions or who have been blown through doors or who have had the shock waves of explosions that make changes in their brain and in their skull and the way it moves. And so this is one of the reasons, these are many of the reasons that I chose to move into another technique to be able to, again, my goal is always to help as many people as I possibly can. And so that's why Dr. Josh and I have been learning how to do this. This all started with Dr. Joseph Jancy back in 1909. He called it nasal specific technique, and then Dr. Stober changed it, did some tweaks to it. He called it bilateral nasal specific technique, and now the one that I'm doing is called nasal release technique, and I believe that a lot of that has to do with the change in using the eye movements. So Dr. Stober's theory is that the brain and the body dysfunction are caused by jamming of the cranial bones. And there's a technique in chiropractic that's called it's called NUCA. And it's all about adjusting the upper part of your, the upper part, the very top joint of your spine and parts of the skull. There's also your occiput. There's also a technique called cranial sacral technique. This is kind of a derivation from that technique as well. But nasal release technique unlocks the cranial bones in a domino effect by specific ballooning placements. And so that's where we're at here today. So here's what everybody wants to know. Well, what kind of conditions can this help with? Now, realize that this is a list of techniques, of conditions that have been helped with this. I'm not saying that everybody who has every one of these conditions can be helped with this or will be helped with this. I'm sorry, there's no guarantee. But what I'm saying is that there are a ton of people with all these types of symptoms that have had major improvements and in fact complete reduction or removal of these symptoms. So post-concussion symptoms. Now, what are post-concussive symptoms? I mean, there are so many: vertigo, dizziness, balance issues, fatigue, light sensitivities, headaches, migraines. I could go on, and a lot of them are in here. Facial pain, pressure, congestion, fullness. These are different types of things. We just talked about vertigo and balance issues. One of the things that this is, and again, I can't tell you for sure, but I would say I understand the part with snoring and sleep disturbances, because since I've been doing this, I can breathe much better while I'm sleeping. I haven't asked my wife, so I don't know if I snore less, but I will. Sleep apnea is another thing that a lot of people who have had sleep apnea, it's helped them. And remember, sleep apnea a lot has to do with changes in the nasal area where people can't breathe. Nasal obstruction or blockage, headaches, migraines, sinusitis, tinnitus, PTSD. We just talked about PTSD with veterans. I was talking to the woman who actually taught us how to do this technique. The first time she had it done, I think it was like 20 years ago, she had it done to herself. And since then, she said, I've never had another sinus infection since then. Neck pain, jaw dysfunction. Remember, if the bones of the skull aren't working properly, your jaw can't work in that groove right. So that totally makes sense. I just watched a video with a man who had Bell's palsy, and he got some changes with this technique with Bell's palsy even. Typically with Bell's palsy at the office, we use the laser and adjustments and nutrition, and we get great results there as long as it's brand new. If it's been going on for a long time, I haven't had the same kind of results with it. Poor concentration and focus. So those were all of the types of things that you can see changes with and improvements in. Now, what are the contraindications? Well, it makes sense that hemophilia would, because if you put a balloon up the nose and you if with the tiny little blood vessels there, depending on what's going on, you could cause a bleed, and then you'd be dealing with a lot of bleeding. Patients with blood thinners, same reason. Nasal fistulas, that's where there's essentially growths that are stuck in the nose that are causing problems. Aneurysms, recent nasal fracture. If you just had your nose broke, this is not the time to do something like this. Previous facial surgeries, depending on what they are, that could be an issue. Severe cranial osteoporosis. That means that if your skull has severe osteoporosis, it's probably not the best technique. Cocaine users. Why? Because you're trashing the mucosa up there, and putting up a balloon up there could tear the mucosal if you have very thin mucosal, again, causing bleeding issues. And emotionally unstable patients. And finally, choanal atrasia, which is congenital narrowing of the back of the nasal canal. And finally, what kind of side effects? Well, we haven't had any side effects with what we've done here. My son Matthew had a little bit of bleeding for about, maybe 4 seconds or so after one of them. But these are things that you could see, not necessarily extremely common, but they can nosebleeds, soreness in the maxillary or in this area right here where the maxilla and the zygomatic arch come together. I mean, if you're moving bones, things can change. Tender nasal passages, tingling of the maxillary incisors, that's your teeth, sore gums, temporary headache, throat irritation due to drainage. I will tell you, the thing that I have noticed the most is when I do this to myself, it really clears me out, and I end up having to spit out a lot of phlegm because it's just draining my sinuses like crazy, and it just feels so good afterwards. to be able to breathe very well. Symptoms can persist up to 3 days. Again, it's not typical. Nobody here has had anything that's lasted other than Matthew for more than probably 4 seconds or so. And then finally, when will we be doing this at the office? Well, we're probably going to be getting, I want to finish being completely proficient in this, testing a lot of, doing this with my family, my extended family, and some friends. And then I'm already feeling very comfortable with it. But I would say before the end of March, possibly the middle of March, is when we'll be getting started doing this at the office. So now is the time for questions. Does anybody have questions, comments? How uncomfortable is the procedure? All right, so I will tell you that it's not like, oh, well, that's just like blowing my nose. It is uncomfortable initially. So if I put this in my nose and I blow up the balloon, you feel it expand. I have found that as I get the balloon farther back into the nasal canal area, it seems like it's a lot easier because it goes back into the nasal pharynx easier, and it's not just blowing up higher. So again, these are things as I'm doing this on myself as well, that I'm learning what is the most comfortable, what kind of issues would we have with this. As far as pain that lasts or anything like that, nobody here has had any kind of pain that lasted more than a whoa, and then it's over. Because it's not something that you blow it in and quick, it's like you blow it up and then immediately you let the air out of it. As far as how long does a treatment take, I'm guessing somewhere in the 10 to 15 minute range, because remember, we've got 8 different areas that we do. We have the bottom, the middle, and the top, and then we finish up at the bottom again. So how many treatments are usually needed? That's different with everybody. From my understanding, it's somewhere in the 6 to 10 range, is what, as I continue to do this more, I'll know more have a much better understanding as to how many treatments it would take. But from my understanding, speaking with the other docs that were part of we're doing the training, or the doc that did the training and the others, it sounds like it's somewhere in the 6 to 8 range. But again, I've noticed each time I do it, I feel great for a period of time. And I'm getting into the harder part of it right now. So we'll see as we get through this, how much it reduces the big thing that I want to see is I want to see a change when I lay on my right hand side at night, because I can't breathe through my nose when I lay on my right side. I've been getting the ability to breathe through my nose for part of the night now since I started doing this. So, and I've done it, I think 4 times, three times or 4 times. Insurance coverage, don't know. Again, I will find out about insurance coverage on that as to whether insurance pays for that or not. My thought on it would be that I would probably charge it as an office visit, which should make it be allowed to be covered by insurance, because that would be based on time. Okay, can this be done on an 18-month-old? He was stuck in the birth canal for 4 hours. My understanding is yes, that it can be done on babies. There is a smaller cot that I have. I have different sizes. I will find out more about that for you. I know that I know that she was talking about doing it on little ones. So I would imagine that it would be a great time to do it on a little one, specifically because you're going to be able to open up the airway a lot quicker. Yeah, stuck in the birth canal for 4 hours. Probably had a very, they call it plagiocephaly, where the head is twisted quite a bit. I'm really excited to start doing this with other people other than my family. I'm just excited because I know that it's got such far-ranging improvements. I've seen when we went to the seminar, we saw videos of a MMA boxer who, you know, as soon as he looked up, he would like almost pass out because he was hitting the head so many times that just looking up, he couldn't. He completely lost his balance. And in one treatment afterwards, she videoed him, and he was able to look up, and he's like, "Wow, that's amazing." That was a guy who was a boxer. There was another one that I saw. I'm trying to think what some of the other ones were, but I'm looking forward to this. As I told you before, there's a whole bunch of different things that it looks like it works really well for. I will know more as we start doing more in the office. All right. Well, thank you for coming. Take care. God bless, and we'll see you soon.